Hello and welcome back to PharmaApex Tutorial. Today we are going to discuss part 4 of Unit 1, which is a very important topic from exam point of view, and that is prescription. So today we are going to cover definition, parts of prescription, handling of prescription and errors in prescription. So let's start with the definition of prescription, which says that it is a written, electronic or verbal order from a licensed healthcare practitioner such as a doctor, nurse, practitioner or dentist authorizing a patient to be provided with a specific medication or treatment. Let's just simplify the definition. It says that it is basically a written order from a doctor that tells you what medicines to take, how to take a medicine, or how often to take it. Now we'll discuss parts of prescription. It consists of several key parts, each serving a specific purpose to ensure the safe and effective dispensing and use of medication. The main parts of the prescription are: first point is the patient information, which consists of name, address, age or date of birth, gender of the patient. Then next is date. The date is when the prescription was written. Then superscription. Superscription is the symbol which we see at the left side of the prescription, which came from the Latin word receipt, and it means as to take. Inscription. Next part is inscription. The name and strength of the medication is known as inscription. For example, amoxicillin is the name of the medicine and 500 mg is the strength of the medication. Next is subscription. Subscriptions are the instructions to the pharmacist and not for the patient on how to prepare the medication. For example, quantity to dispense, how much quantity to be dispensed to the patient. Next is Cigna. It is a direct iron for the patient on how to take the medication, which includes dosage of how much to take, route of administration such as oral, topical, and we have studied a lot of different route of for administration. And frequency. Frequency is how many times a day the medicine should be administered. For example, 2 times a day, 3 times a day. Next is duration. For 10 days, how many days medicine should be taken. Next is refill information. It is the number of time the prescription can be refilled if applicable. That is, refill information is used when you need to get more of the same medicine after finishing the current supply of the medicine. So we know if we can get more without seeing the doctor again. Next is prescriber's information. That is the person who has written the prescription. It consists of name, address, contact information, professional credentials, that is the degree such as MD or etc. Then DEA number, it controls substance are prescribed. And the last part is prescriber signature. It is an handwritten or electronic signature of an healthcare provider. Each part plays a crucial role in ensuring that the prescription is accurate, clear, and legally valid, facilitating proper dispensing and patient adhering to the treatment regimen. This is an example of prescription which consists of all the parts that we have studied till now. That is the date, age, name, weight of the patient. RX is the superscription. Next is the name of the medication. 500 mg is the strength of the medication. Next is the route of administration. That is, here it is tablet, so it will be the oral route of the administration. Next is this is the medicine. 10 is how many number of medicines should be prescribed to the patient. BID is for how many times medicine should be administered, for example twice a day, thrice a day. And 5 days is how many days the medicine should be prescribed. Next is signature. The medical practitioner signature is there. This is registration number and seal of the doctor. So this is the basic prescription that we have studied and covered all the parts. Next is handling of prescription. Handling of prescription carefully is an important because it ensures we take the right medicines in the correct amount, or it is helping us to get better and avoid harmful side effects or mistakes. It consists of several steps to ensure the medication is accurately dispensed and used safely by the patient. So, for healthcare providers, the writing the prescription and providing patients instruction, these are the sub-steps of handling the prescription properly. Here, the healthcare provider should write the prescription in a proper manner so that the pharmacist should get all the details about the prescription, and providing patient instruction, and also provide the instructions properly to the patient so that there should be no confusion to the patient side. Next is for patient, the first point is receiving the prescription. While receiving the prescription from the doctor, clear all the possible doubts you have with the doctors so that there should be no further complications in the treatment. Next is filling the prescription. Provide all the correct information to the doctor, for example your age, your gender, all should, this personal information should be correct so that it gets easier for the doctor also to prescribe the medication and the doses. Next is at the pharmacy. Next step is take the prescription to the pharmacist and hand over the prescription to him, and answer about insurance policies if he is asking for, and pick up the medicines with clear instructions. Next is receiving the medications. Here at the pharmacy, a pharmacist will review your prescription and dispense the medications to you. They may also provide instructions on how to take the medication, and the duty of the patient is to ask question at the pharmacy if if he or she is unsure of the instructions mentioned, and mention the medicines you take to avoid the interactions of the medications. Next is for pharmacist. First is patient monitoring. Pharmacists may monitor patient taking certain medications to ensure they are safe and effective. This may involve checking on patients for side effects or making sure they are taking their medication in a prescribed way. Next is adherence. Pharmacists can help patient adhere to their medication regimen. This may involve providing education on the importance of taking medications as prescribed, and answering any question patient have about their medication and dose, such as how to take the medications, when to take the medications, etc. Next is refill. Pharmacists can also help patients refill their prescription. This may involve contacting to the patient's doctor to request a refill the prescription once it is authorized. Now we'll discuss the errors in prescription. Prescription error can occur at various stages of the prescribing process and can lead to a significant harm if not identified and corrected. Here we will discuss some of the common type of prescription error and their potential causes. The first one is illegibility, that is the bad handwriting of the doctors. So here handwritten prescription that are difficult to read can lead to misinterpretation of medication, dosage or instructions. Here, if a doctor's handwriting is messy, the pharmacist might misread the prescription and the problem can occur. Next is the incorrect dosage. Here the doctor might prescribe the wrong amount of medications. So what is written is prescribing the wrong dose, either too high or too low, can result in ineffective treatment or adverse effect, which is the dangerous part. Next is wrong medication. Prescribing a medication with a name similar to another drug can lead to dispensing the wrong medication, and here the doctor might prescribe the wrong medication to the patient, which can lead to the error and which can lead to a major problem to the treatment. Next part is inappropriate medication. Prescribing a medication that is not suitable for the patient due to their age, medical history, allergies, or other medications they are taking. The drug interactions. Failing to identify potential interactions with other medications the patient is taking can cause adverse effect or reduce the efficacy of the treatment. Next is frequency error. Incorrect instruction regarding how often the medication should be taken can lead to overdosing or underdosing of the treatment. Dispensing errors. Errors that occur during the dispensing process at the pharmacy, such as giving the wrong medication, wrong strength, or incorrect labeling, can lead to a major issues. So here we are done with the prescription. Thank you so much for watching. If you enjoyed this video, don't forget to like and subscribe for more content. In the next video, we will be discussing the next topic of this unit. Till then, keep watching and keep learning.